They tell the job actually finds you. You don't go and find the job. The job seeks you. So it's true in your case, right?
And if you're in football, there are some degrees called as FIFA medicine degrees, diploma in FIFA medicine. Also try to do that. Now imagine you've done a ACL surgery, and imagine a person is never having carbs. That's not a good sign.
And, So hello guys, we are in yet another podcast series with Brew with Bones. This time a new series of episodes called The Road Not Taken, where we will interview surgeons who have taken very uncommon pathways to success. So first in this series we have Dr. Nelson Pinto, a traveling sports surgeon, one among the few in India. So without wasting much time, we will shoot out questions and grab his mind. Good evening, sir. How are
Good
you?
evening. Good evening, guys. Nice to see you guys over here. And I think you have a nice T-shirt with a good brew, man.
Thank you, sir. So this,
What is that red? What does that red signify?
so this is our logo. So
Okay.
we just started out meaning that whenever you feel bored and have a cup of coffee, you can come to a channel and read our
Okay.
newsletter. So
Oh,
it's
nice.
Brew with Bones.
Okay, that's a very
The
nice,
red one is
interesting
actually
concept.
a red marrow, sir. The red one is actually red marrow. It's a
It's a
bone.
Wow.
bone. It's a
Oh,
bone.
oh, awesome. That is going to be a basis of biologics, huh?
We haven't thought out like that, but
Yeah, it's a new point to add now.
yeah,
Yeah, it's
it
very
makes
nice, very nice.
thank you so much, sir. So tell us about yourself. How did you, get into sports medicine after orthopedics?
See, problem, what was that? Is like I did my DORT first in Father Mullah Medical College in Mangalore. So after I finished my DORT, we have to do a secondary DN basically. So I was working in a medical college back in Mangalore. And once I got a seat into the DNB, so we had to start doing the DNB in. I was doing that in Jahangir in Pune. So during that process, I think that's a life-changing opportunity for me during that period because there were a lot of sports activities happening in Pune and in around Pune. They had a lot of football teams, they have academies, a lot of sports patients also, which were actually kind of inspiration for me. So we used to handle this the sports thing, like on the hospital basis, we used to handle their injuries, and used to do all the ground medical services for them. So we were the medical partners. So this is how I mentioned. This is how I met all these people. I met a lot of doctors there and a lot of people around, and that's how we started a small bond with the players. And during that period, I think we all know. Leander Pace, right? So his dad is a surgeon. He's a surgeon, and he was a main team doctor overall for the Indian Super League back then in 2013 or 14. And that moment, he saw that I was very happy with my medical services and whatever we did, as a part of the medical partners. So we did really well there. And so he said that, Doc, I'm really impressed. And why can't you just think of coming into sports? So during that period, we had also a good unit where you had arthroscopy, you had spine, you had trauma, you had replacements, everything. So it was like a fellowship to me because we are on a basic degree. So 3 and 4 years, right? So it's a fourth year for us eventually when you go for second year in DNB. And probably used to get a different variety of cases with the surgeons. So used to go with them wherever they are. And, they've been the inspiration from Dr. Verspace. His dad's name was Verspace. He said me, you have to do something for the sports thing. And why can't you just work out more on that? That actually triggered a kind of concept in me that once I finish my DNB, I'll be going back and doing that. So I was back in Kerala working in a hospital, and I knew some friends of mine, and I found out that there's a club in ISL called as FC Goa who were looking for doctors. And when I asked them what kind of doctors do you want, they said that we wanted a doctor because initially doctors used to just come and just treat and go. So they didn't have the full-time doctors in their concept of sports. So I said, look, that is not very. We can actually be better because you can if you are expecting a doctor who is a specialist in musculoskeletal injuries, that is orthopedics for you. But if you want them to get the best out of the team or give best to the team, we need to understand one important thing that I need to be more involved with the team. That's where the best out of people comes. And then they said, yes, we are ready to take an orthopedic surgeon because that was our dream, but not many people have ventured into it. So I said, okay, let me try this. I said, give me 1 year. I want to join you guys and let us see how that works. So that was my 2017. It was my first time I took actually a leap in my life. So I was doing working in a private hospital in Kerala, and I decided, okay, let me leave there and let me go there, because let me start changing some things in sports scenario. Till then, actually, the orthopedic surgeons had never ventured into the sports. They were more of sports medicine doctors who were doing that. So, but what happened was, like, they had to run all over India to get their surgeries done for sports cases. So they said, okay, fine, you take over it. And once I went there, I understood the dynamics of the team, spent time with the daily teams. And that's how I started developing rapport with players. And eventually, I just started continuing my process, because I was enjoying this moment. Because you see a player, you treat him, you see day in and day out, you see how the physios rehab your case, what your decisions you have taken. If it doesn't happen, you operate. You see that daily basis, whatever you have done. Because in my medical practice, you miss out players, or miss out patients after a particular period of time. They come once a month or twice a month for a visit. But in this case, you could see them daily how they progress, and you knew where are the things you have to identify as a sports surgeon where you can make their life better, be it career wise or be it their personal health wise. And I think over a period of time, I just gelled in, and today we reached a stage. Then I went into a next club, that was Mohan Bagan, which I'm still continuing with myself. And then during that period also, I had seen some cricket players, and I thought, why not go into an IPL? So I tried my luck with the newest franchise then. It was Lucknow Super Giants 3 years back when they came into the IPL. And they were impressed by what I gave them on table. So that's how my journey into IPL and ISL happened. So I became a part of the sports journey now.
So they tell the job actually finds you. You don't go and find the job. The job seeks you. So it's true in your case, right?
Yeah, sometimes, yeah, by God's grace, it works. And that's sometimes, if it works, it's nothing better than that. So I think we should keep trying. We should keep poking in, giving our best. It works most of the times, but sometimes will not be working. But you should keep trying, because if you give your 100%, then if you go, behind your dreams, I think you will definitely reach that one day. Maybe you'll be a bit patient with life. Always patience is very important. You don't get it at the time when you want it, but definitely over a period of time you would get it.
Definitely, those are true words. I can't agree with it more. Considering that you've taken a road that no one else has before traveled. Most of us after doing medicine, we are a bit conservative. We want to be safe. That's the first place we got into medicine.
Absolutely, because I tell you one important thing. What I've realized in the last 7 years, we orthopedic surgeons can actually change the entire picture of sports in India. Because why I'm saying that, we are an expert in musculoskeletal structures, and also when we identify some problem, even we can do a surgical thing and get them sorted. Because it's not that you see them on a daily basis, and especially when an orthopedic surgeon becomes a part of a particular team or a sports team or anything, you actually give a extra mileage to the clubs. Ask the clubs who have worked with me. They always had very, very comfort. And even when I left FC Goa, the FC Goa first time tried to search only for orthopedic surgeons, because that was the impact what the orthopedic surgeons can do in a sports field.
True. Everyone obviously will agree with the point that it's the most glamorous job out there. But only you can tell us the challenges. So by challenges, I mean obviously you took the road that's less traveled by, so you should lay your own path. We can get that. But technically, as an orthopedic surgeon, after we get out of residency, do you think we are all equipped with the knowledge that is needed to treat sports people, or should we equip ourselves more?
See, as orthopedic surgeons, no. Once you are done with your fellowships in sports surgeons, you know why I see most of the people ask me, what is the best career? I say orthopedics is the best career. Not that I want to deny or I want to demean other professions. Now, what I'm saying is, if you're a sports medicine doctor, the chances of you, after, in case you don't get a club, imagine the club is saturated. It's difficult to run the place in all the cities. Not every place you have all the things. But if you're an orthopedic surgeon, not only you can survive in a club when you have them, and you can flourish. But God forbid, imagine you don't have a club, you don't get a club. You still can go back to your city and do the normal orthopedics stuff and move on, right? But the main challenge, for orthopedic surgeons after that, I would always expect, once you're done with your orthopedics and doing your fellowship, and if you're in football, there are some degrees called as FIFA medicine degrees, diploma in FIFA medicine. Also try to do that. Little bit of general physician is required. See, whatever we learn in our internship before we started our PG, It's definitely help you to get the basic things out, basic things in the team when you're part of. If you do these basic things of basic knowledge of the basic medicine, basic diseases and treat them, get a good doping or knowledge, and if possible, you get an extra edge is nutrition. Because this nutrition not only helps you with the players, but also for your players after your surgeries. Now imagine you've done a ACL surgery, and imagine a person is never having carbs. That's not a good sign. Imagine not taking proper protein. That is also not a good sign, because we need good protein, good nutrition. We need good supplements, and 90% of them should be from natural sources. So it's always better that you have some knowledge of nutrition for a basic thing on the record. But if they have to be extremely advanced, then you have nutritionists around you. So you can definitely take an opinion once in, or you can, even if they're giving you a particular program, you can monitor that program, isn't it? So I think after your normal degrees of whatever orthopedics you have done, after your fellowships you have done in sports and everything, also you should do a little bit of doping, bit of nutrition courses, and just be oriented with the basic thing. Like imagine you encounter a situation of an ENT, dermat, or any other ophthalmology. At least you should know to diagnose them and refer to the right specialities. That much knowledge is more than enough. Although the 90% of your injuries is musculoskeletal, your fitness of the player is musculoskeletal. Whether it goes in or not, whether the club signs him or not, or takes up in auction or not, is purely based on musculoskeletal injuries on a majority basis. There is nothing wrong in also knowing the smaller part of it, which are also important for a daily survival.
So that's a very comprehensive yet simplistic answer that we can get. We were very positive. So we should have knowledge on doping and some sports nutrition and sports specific knowledge. That's what you.
Absolutely. That's always gives you an edge, always an edge.
So
So
we
this
are
is to get the best out of a sports physician or a sports surgeon.
Yes.
So do you miss general orthopedics, or what is the thing that we miss as being a sports surgeon?
See, now what? I had a lot of experiences because when I was in football, I had a couple of elbow dislocations with the fractures. So now, when the people ask me like, what we have to do with these players, so we did. We also tried. Not that you're going to use the hand much in football, but you need to have a small protection of yours, splints and stuff. I still made him do all the drills, which without using the hands, but all the lower limbs. Try to get him in picture for 2-3 weeks. I somehow managed him, but not giving him complete rest. Now, what I've learned in sports is that whenever a problem of trauma arises or something, if this is an upper limb, we always give a rest. The patient goes back home, takes rest, comes back after 4 weeks. But here I never do that. Here I always try to see what part of the body is intact. Okay, his legs are intact. Okay, why not do the lower gym under supervision? Obviously, we have our supervision. So I always believed in that. I never tried to give a complete rest to a patient, even before a surgery or after a surgery. So I always try to see which part of the body is still intact. Why not stimulate it? Why not get better of it? Although we'll not ask him to do, like imagine his left hand is fractured. I don't ask him to do the weights in the right hand because that's not right. Because we always maintain a symmetry. But otherwise, I would always like them to do something on their own. I never like resting. In sports, that is one important thing you should understand. Don't give a long-term rest to people and not keep them under your observation. Because in athlete, the main important substance in them is the fitness, the strength, conditioning, and the fitness. Which not you do it, but you have a particular people to do it, but you have to monitor it. Like after my ACLs, the biggest worry I have is the quads and the VMOs. So if I don't see these VMOs and quads stimulated on a regular basis, even when the player is not doing anything, even post-surgery, I'm very tensed. Because, it's not easy to get the range back. It's not, not going to, the graft is not going to protect him when he's playing. So all these things are there in my head. So what I've learned in sports scenario is not to give too much of rest to players and not give a generalized thing. Okay, go home and come after 2 weeks. No, you can't do that. In that 2 weeks, lot can change. Be it a trauma or be it a sports injury. A lot of things can change in that 2 weeks. He may not even put a knee brace and sleep in the night, and he may develop a flexor flexion deformity by the time he comes in. You're almost in a soup. So this is the most important thing. After an ACL surgery, you would wonder that they will not put a brace in the night. What will happen? Some effusion will be there. They try to keep the leg bent. They are more comfortable. When you come back, you will see a FFD. These are the things you should always know. That you have to keep a close watch on it. So this is what is a little difference from them. You have to, even though you're not seeing a patient, you should always be in touch with the physio who has referred you the case, who is taking care of the case, and follow a particular protocol and see this is not right. Stop it. Send me the videos. Send me the pictures. What happens at every week. So I prefer that. I don't leave the patient after surgery. I follow them till he starts playing. This is something which a little different from the normal practice because it's very difficult to get in a normal patient. Very difficult to get a track of them after 2-3 weeks.
Yeah.
They will never come back to you or they don't follow it up because they just have to live a sedentary life. Here they have to build their careers. Everything depends on them.
We can see the passion oozing out from your words. So when you tell, you should get them back as soon as possible. So it's quite different from other orthopedicians, right? So I do ACLs and Satish does some spine, but when I do ACLs, I don't care if they're going to run again or not. Even the patient doesn't care. He himself
Correct.
tells, Doc, I'm not going to run. Make
Yes.
me walk fast. That's all I. When Satish is going to operate some back, he's going to tell, just I want to, ride a car. I can even avoid two-wheelers, but I should get away from back pain. It's not the case with you. So if you're going to operate back on a fast bowler, you should get him back on the same speed. So is it adding pressure to you? And
Yes.
should you be at the cutting edge always?
Yeah,
to bring him
that's
up?
exactly what I was saying, Giri. That's very important. When you get these cases, you have to completely do a thorough examination of them prior to the surgery. So I always believe in pre-abs. If you're an ACL, you always have a pre-ab. So I think if you all know, just go and see something called as an Melbourne ACL rehab protocol. Okay. So in that Melbourne ACL rehab protocol, you will see what are the criteria you have before a surgery should be done. So what I do in that case is that we try to keep the player up to 3 weeks, though we don't operate him. We try to get the swelling as much minimal as possible, try to get the range of motion as much as possible, and also we try to get the strength almost 80 to 90% of the normal leg. If there is a meniscus injury like a complex, we can't get the range, fair enough, but at least we can try to get the swelling. So we wait for the basic things to happen. If it is going on a good direction, yes, we wait for 2 to 3 weeks. But if you're not able to get it, then okay, if the meniscus is painful, he can't bend, he can't move, the daily activities are getting painful. Once we allow the knee joint to be stable, we start the surgery. We do the surgery. And now what has happened is like after the surgery, this happens. Now again, we are trying to be a very, very important monitoring. I try to do as much of range as possible on the first day. If you can get 90, fantastic. CPM, I would love to get that. Because main important thing now, not only you should get this player back, but he should play to the level of what he was playing because that is his livelihood. The club will not take him if he doesn't become a good player again. The pressure is not only on them, pressure is on us also. If you don't deliver, so you'll get a lot of cases if you really do your job well because you get reference all over the thing. Because see, let us be very frank, this money is not a criteria here in sports. Okay, that will come, that will go. Nobody questions about how much is your bill. In the end of the day, you don't have the issues there. It's all about the after results. Whether the player is playing or not playing, that's important. That's what matters the most. And in that condition, if you're done well, you will get a lot of cases. If you make a mistake, that's the end of it. Very difficult to come back. So you have your own challenges there. But here again, after that protocol I told you, there is a particular protocol for what to be done in the first month, second month, third month, fourth month, fifth month. And once you have completed your entire treatment, there are certain tests for the player to go back to football or cricket. And there are certain gym programs they have to convince, some yo tests, they have to do Y tests and stuff. And after that, it is cleared, you put them in training, no matter which game they play. Some people will have good results, some players will have very good recovery potential and some will not. Now here it's very important to see how the patient takes place on a daily basis. How is he responding to it? Is he getting the good range of motion? Next day he's okay. Sometimes people push through the range and tomorrow they can't even bend. There's a lot of bleeding, there's a lot of effusion, and you have to go for arthrofibrosis in sometimes, after some time. So we don't want all that to happen. So it's very important to observe on a daily basis. If it is your player, it's very good. You see them on a daily basis. Be it ACL injury or a muscle injury, you see them. So then here the protocol is, the first few days for the acute phase, we wait for the rest, ice compression, right? As soon as it is better, we try isometric. We don't wait. And if he's doing the isometric for 2 days, and the third day is not feeling sore, we continue progressing it. So a person, one good player young, he may start doing it in 3 days, but some player who is around 35, 40 will take at least 6 days to actually respond to the first isometric or dynamic thing, whatever you have done. Then you have to slow down. So the concept of sitting in the hospital, oh, you have got a grade 2 hamstring today, you're out for 6 weeks, it will never work anymore. If you do that, you are in trouble. So it's very important for you to understand, look, this is the situation now. Here is your plan. do the acute management, try the isometric exercises. Once you're done, give me a call, wherever you are. Talk to the physio. Okay, this is how he's progressing. Okay, then progress it. No, sir, he's not progressing well. He's having a lot of pain and not doing well. Delay it by 4-5 days. That's how you deal it. If you come and directly say, oh, grade 2 out for 6 weeks, imagine he's a 20-year-old fellow, he'll be actually wasting a precious time. But they won't stop there. They'll start going and shopping for every day. Now imagine the player who came to you at the second week. You are right in saying you're 6 weeks. But the player when goes to the fourth week to another surgeon and he feels that, okay, this guy is moving well. This guy is having a good range of motion. He has no pain. Why are we stopping him? Go ahead. He may be telling you, okay, maybe you are good in 4 weeks. So then the problem arises. Oh, the doctor said 6 weeks. This doctor said 4 weeks. I think that doctor who said 4 weeks is a better surgeon. And the 6 weeks is not a big surgeon. So it's not to do anything with a good surgeon or good thing. It's all about how you interact with the players and how you convince the clubs, how you convince the physio. What are the recovery potential in individual people? So this is a very important thing, I think, when you're thinking of a sports setup. That's very important. I always highlight them right from the beginning that you have to follow up. Here, it is not about going for quantity of cases. It's about the quality of cases. You have to follow it up till the boy starts playing, a boy or a girl or athlete who's playing. That's very important.